Good day everyone, we are the group 3 from BSN 2B. I am Trishalian M. Horka and together with my groupmates, here we present to you our topic which is all about the augmented reality in nursing education. Now for our introduction. So as modernization continuously revolutionized the way how the world works, or simply the way how we live today, especially in this time of pandemic, where we are required to utilize technology, there have been several advances in our technology so far. Now we can even experience existing technologies involving the integration of the real and the virtual worlds somewhere along the virtuality continuum, which connects the real environment, entirely the real environment, with the virtual ones. Probably one of the best known kind of this immersive technology is the augmented reality, for it is a bridge to a wider reality. Now what is augmented reality? It refers to a technology that supplements the real world with visual objects that appear to coexist in the same space as the real world. It is an experience where designers enhances parts of the real world environment with interactive digital elements like vibrant visual overlays, buzzy haptic feedbacks, and other sensory projections. Now these are some of the things where we can use augmented reality. For inventories, for navigation systems, for educational purposes, so that's augmented reality. Augmented reality offers a wide range of possible uses, and people might have experienced it in action without even knowing, like simply in different navigation systems like what I've said before, or in GPS-operated applications, games like the Pokemon Go, or even just the social media popular Snapchat filters. But of course, augmented reality is more than just a gadget and a smartphone fun. It is a whole technology that seeks uses in more important matters, from business to warfare to medicine. Now, nursing, or more specifically nursing education, is one domain where augmented reality is best utilized. Now, how does it contribute to nursing education? Augmented reality is like a real game changer in nursing education. AR as a learning tool enhances how the student perceives and engages with the actual world. It makes the learning more interactive, engaging, and effective via the utilization of realistic scenarios with digital and computer-assisted technologies. As a matter of fact, it can even help doctors examine patients' organs, enables patients for better describing their symptoms. It can help assist surgeons and nurses in the operating room, and especially, it upskills medical students like us for more practical and hands-on experience. So evidently, employing augmented reality in nursing education enables them to study in simulated ward, in home, and other actual setting while being guided. So there is consistency and increased potential in safe education while being supervised by a clinical educator. So that's how augmented reality contributes to nursing education, which is to be further explained by my groupmates.
Good day everyone, my name is Jeanine Eftaminiano and together with my partner, Felga Lope, we will be discussing the evolution of augmented reality. The evolution of augmented reality. So this timeline will show you how augmented reality has been developed and changed the experience of the human beings from the beginning up to this present time. It was around 1957 when cinematographer Morton Heilig invented Sensorama, a machine that is multi-sensory technology which provides visual, sounds, and vibrations to the viewer. Fast forward to 1968, the first AR technology called head-mounted, or also known as the Sword of Damocles, was invented by the computer scientist Ivan Sutherland. It is a heavy device that is suspended on the ceiling, providing the user to experience realism, and the graphics comprising the virtual environment were simple wireframe rooms. While in 1975, an American computer artist named Myron Kruger developed the video plays. The video plays use projectors, video cameras, special-purpose hardware, and on-screen silhouettes of the users to place the users within an interactive environment. Users in separate rooms in the lab were able to interact with one another through this technology. The movements of the users recorded on video were analyzed and transferred to the silhouettes. In 1980, Thomas P. Caudle of Boeing Research coined the term augmented reality. He was a PhD in the fields of physics and astronomy from the University of Arizona, Tucson in 1980. Following that, he was a senior staff physicist at the Hughes Artificial Intelligence Center in Malibu. So again, the researcher coined the term augmented reality. Around 1992, a researcher in the United States of Air Force Armstrong's research lab named Louis Rosenberg developed the virtual fixtures. It is the first ever fully functional augmented reality. It had made an impact on the military force to perform a virtual control and guide machines to perform activities like training their U.S. Air Force pilots for their safer flying practices. So, the virtual pictures use two real physical robots controlled by a full upper body exoskeleton worn by the user. To create the immersive experience for the user, a unique optics configuration was employed that involved a pair of binocular magnifiers aligned so that the user's view of the robot arms were brought forward so as to appear registered in the exact location of the user's real physical arms. While in 1999, the National Aeronautics and Space Administration, or the NASA, innovated a hybrid synthetic vision. So the system used augmented reality to overlay map information on the screen of pilots to provide enhanced visual navigation.
Hi, good day, I'm Fel Galope. Moving forward to 2000, we have here the Japanese professor Hiroko Kazukato invented an AR that is a software library that can overlay virtual imaginary on the real world. You can use this by scanning a marker or the QR code of the different work and overlay different images. On 2009, an Esquire magazine, a famous men magazine in the States, released the first ever magazine that brings pages to life, featuring Robert Downey Jr., aka the Iron Man, where the movie was hit, both as synchronizing the importance of technology to the society. To enable this by scanning the code plays a vital role to access and animate the 3D video. With 4 long years, Martha stands for Mobile Augmented Reality Technical Assistant, a mechanical application exclusive only for Volkswagen and iOS user that can be a help to repair and replacement of any mechanical problems of the said brand. This features the physical changes such as the color, windows, or the parts of the car that can assist by the owner. Following year 2014, the famous search engine Google decided to release their first ever device called Google Glass, where it is a wearable eyeglasses device inspired that has a visual, audio, and motion control that displays information directly in the user's field of vision, a convenient device that can be used on a daily basis. Next up, we have the world-famous augmented reality game from the Japanese anime named Pokemon, developed by John Hunt, an American technology executive that has a famous work such as the Google Earth and Google Maps. Pokemon Go played as a character appear on the game map. When the users comes within the close range, the Pokemon will appear on the device screen and the users throw Pokemon balls at them to capture them. On the last leaf of augmented reality evolution of history, we have the IKEA, a famous Swedish company that is known for their unique interiors and home accessories. With a big company, only limited supplies and branches are exclusive to a specific country, but releasing an application that can help the consumer to virtually place the IKEA product that can match their house space within the most easiest way. Lastly, with the breaks out of the AR history, we increase our knowledge of AR technology. We further recognize its importance and role to society. AR does not only let us experience a combination of virtual and reality worlds, but enhances our creativity with the help of technology. Given the images, it does promote an unimaginable expansion regarding different sectors around the world, making lives much easier and better.
I am Jen Rosie Puentes. As augmented reality or AR technology which projects digital information onto our current surroundings and allow us to interact with it, enable us to experience the real world with 3D virtual objects by adding sounds, elements, or other sensory stimulation.
I am Joseph Gabriel P. Hilario. AR creates opportunities for teachers to help students grasp ideas by using the interaction and experimentation that AR technology offers. Teachers can now enhance classroom experiences, teach new skills, inspire students' minds, and get students excited about exploring new academic interests.
Nursing students can benefit from it and use it in their education and training. These are some uses of augmented reality in nursing education. First, it can be used in clinical stimulation, which enables nursing students to put all the knowledge or theory they learned in class into reality by generating virtual scenarios, and as they work to solve the situation, they can develop their critical thinking and problem-solving abilities, so they would not do any mistakes when they apply or do it in real patients. Next, in medical education, augmented reality can effectively aid a student in learning difficult ideas and in concepts, including visualizing organs, vessels, muscle, and bones, which can be viewed thoroughly in 360-degree manner. There is an application you can download to help in studying anatomy and physiology, like the Holoanatomy and Human Anatomy Atlas.
First is the Holoanatomy app. It is a product created by the Case Western team in collaboration with the Cleveland Clinic and Microsoft HoloLens. This app refers to human anatomy using AR simulations, touch surgery that specializes in surgical simulations and allow medical students to practice surgery in virtual patients. The availability of the cadavers for dissection will no longer limit students' learning, nor will the two-dimensional world of medical books illustrations. Indeed, students can dissect a virtual subject through small movements that call up different layers of body systems like skeleton, musculature, circulatory, and etc. Last, holoanatomy is currently in use in several educational institutions, so you would be getting a proven and tested software. Next is the Human Anatomy Atlas. It offers 3D, regional, and systemic views of the human body. It also includes virtual cadaver dissections and modules for muscle actions and microanatomy to see smaller anatomical structures not visible to our naked eye. Specifically, these are what Human Anatomy Atlas offers. First is the full female and male 3D models to study the gross anatomy. You can view this using alongside with cadaver and diagnostic images. And next is the brief animations that explains core physiology and common conditions. You can use this for a deeper understanding of the system processes. And last is the muscle bone models that you can move. Learn muscle actions, bone landmarks, attachments, innervations, and blood supply. And now, for the medical imaging, advanced visualization of complex anatomy in medical imaging for procedural guidance. It refers to several different technologies that are used to view the human body in order to diagnose, monitor, or treat medical conditions. It refers to different informations about the area of the body being studied or treated. It related to possible disease, injury, or the effectiveness of the medical treatment.
Good day, I am Eunigian April de Havate and I am going to discuss the future direction of augmented reality in nursing education. So how will augmented reality change the way healthcare is provided in the future? So augmented reality or AR enables us to experience our immediate surroundings while having a digital augmentation superimposed on them. It functions by instantly integrating digital data into the user's surroundings. Through the use of computer-generated capabilities, real-world items are enhanced in augmented reality. Due to its adaptability, augmented reality or AR is becoming more available and cheaper for dental care, medical education, nursing training, and medical imaging. Some of the leading examples of augmented reality in healthcare includes Acuvane, AR Anatomy, VPAR, and VAST or VAST. So AR in patient care. The majority of individuals find it difficult to describe their symptoms to doctor. AR, however, aids patients in addressing their symptoms and worries to the doctors. Patients can utilize AR to monitor their symptoms and general health status. Doctors can also assist patients modify their lifestyle for the better by demonstrating the implications of their existing habits. Instead of reading the lengthy list of prescriptions, the descriptions for the prescribed medication, patients can use 3D AR technology to observe how the drug works or interacts with their body. So the first few days of nursing are difficult for new mothers. a Melbourne-based business, tested Google Glass in collaboration with the Australian Breastfeeding Association. While breastfeeding, the women may readily discuss their issues with professionals and get advice. Thanks to Google Glass AR-enabled technology, the lactating mothers were able to convey their issues in real time and swiftly seek medical assistance. So AR for surgeons and nurses. Finding a vein to inject intravenous medications or collect blood from the hand might be challenging at times. A nurse can quickly see the vein to collect blood or administer a shot thanks to AR handheld scanner technology. Additionally, the patient is relieved that the vein was located on the first try and it will save time for the nurses and make the young or old not to be subjected to excessive coercion when taking the shot. Using 3D AR, surgeons can do precise operations. It aids in reducing needles risk and raises the success rate of many intricate surgeries. Any tumor can be recreated by surgeons using image reconstruction technology, and it allows the doctors to find tumors anywhere on the body and perform surgery on them while seeing X-ray in real time. Simply, AR significantly lowers the difficulty level and risk. Even though everyone understands how important it is to be healthy, some people take their health for granted, and AR can be used to diagnose the human body and determine its condition of health at any given time. The dietitians and nutritionists can use the knowledge they gain to motivate and influence people to make healthy lifestyle changes.
Hi, I'm Charles Garcia, and as a continuation of the future direction of augmented reality, AR in saving lives. Health problems can occur anytime and anywhere of the day. But through augmented reality, saving lives can be faster and easier. An app called AED for EU was created by Lucian Angelin, which purpose is to show defibrillator nearby to help someone who suddenly collapse. Through this app, we can easily save someone who is in need even without having a medical experience. Augmented reality and the future of healthcare. The smartphone market today is more likely to mimic the future of AR market. Self-care will improve since we shall be our own doctors. Nowadays, we can easily check or monitor our health status through digital devices and of course, with the advice of the health professionals, which is very helpful, especially now that we are going through a pandemic. This type of pandemic, some people are afraid to seek medical advice in a hospital because of the high risk of being infected of the virus. But future direction of AR makes it possible to stay healthy and learn more about our health without going outside our home. AR slowly disrupts traditional imaging space because it allows us to intermix. Through augmented reality, students or learners can access knowledge through a certain device without a hassle.
Again, we are the Group 3 from BSN 2B, led by Trisha Lian M. Horca together with my members Janine Flaminiano, Janil Rose Fuentes, Fel Galope, Cher Rose Garcia, Joseph Gabriel Hilario, and Mioni Gian Havate. This concludes our presentation about the augmented reality in nursing education. Thank you!